And she came in and she was like, Ava has leukemia. And it just felt like my whole world shattered from there.
Well, you just heard from Ayanna Boyd describing the moment that she found out her then 4-year-old daughter Ava had cancer. According to a first-of-its-kind report by the South Carolina Childhood Cancer Task Force, 16 in 100,000 are affected by cancer in our state. Our Josie Frost has more on the trends of childhood cancer here and what work still needs to be done to help treat kids like Ava.
It was like she was hurting for days.
It was over a year ago when Ayanna and Demetrius Boyd started noticing signs in their daughter Ava that something was wrong.
The last thing we saw was just her not walking. And that's what put us in the state of, okay, something's really not right. Like, she hasn't walked for like 2 weeks.
She underwent treatment for leukemia at Prisma Health, getting chemotherapy.
Since then, we've been doctor's appointments every other week, sometimes 2 or 3 times a week. Her being sick is the hardest part for us. Once she gets sick, sometimes it's maybe a week or sometimes it's maybe 2 weeks before she feels better.
There are many more like Ava, with new numbers showing that South Carolina is making strides towards improving their childhood cancer outcomes. The 25-year inaugural childhood cancer report from the Childhood Cancer Task Force found that survival has increased in the Palmetto State while mortality has decreased since 1996. Doctors from Prisma, the USC School of Medicine, and MUSC unveiled the first-of-its-kind study this morning. Dr. Anna Hopman says childhood cancer is an area that needs more study.
Children are not miniature adults. The cancers that children face, their prognosis, and their treatments are different as compared to adults. And we need to look at them individually or uniquely to understand the challenges and how we can improve things even more over time.
According to the report, South Carolina fares better than other states, with fewer incidents of childhood cancer than regional and national rates. For families like the Boyds, their treatments have been vital to see Ava get back to the happy, energetic girl she was. She has a year left of treatment, but is improving.
I can say we have seen a major weight gain. At first, she wasn't as verbal as we wanted her to, and now she talks a lot. I'm expecting God to heal her and it be that, and she grow up to be whatever she want to be.
Josie Frost, News 19, WLTX.
Oh, and we are wishing sweet Ava and her parents the best for sure. Not all of the cancer report on our state was positive, though. The report found that Black children have a higher risk of death at the 5-year mark. Also, it found that South Carolina does have rising rates of lymphoma and leukemia. All right.